Vice Speaker. Minority Leader,
Thank you, Madam
please
Speaker.
proceed.
Health on the line. Good morning, Linda. Thank you so much for your call.
Hi, Linda.
I guess just first of all, I know we had asked yesterday. Everybody's talking about Saipan, CNMI, getting all these test kits. Where are we on that, Linda? And are we looped into? Are we going to see, getting 20,000 test kits or something?
Yeah, that's a good question. But first of all, I'd like to say that I spoke with Ms. Muña, Yasser Muña, the CEO of CNMI Corporation, and these test kits that she received is not FDA approved. They're still applying for the emergency utilization authorization, so it has not been approved yet, and she did confirm that with me. And so, even with that, I have a listing of all the emergency utilization authorization instruments and test kits that was sent to me through FEMA. And right now, as we speak, I'm only authorizing tests to be done on all those test kits and test machines that are FDA approved and they're certified to be approved. We want to make sure that the safety is ensured for those who are tested. And after speaking with her, she also told me that they're not going to be using these test kits for diagnostic purposes. They're going to just be using it for surveillance. Now, in regards to that, yes, we are moving forward with having more test kits, and 2 more Abbott ID new test kits have arrived, and this is also approved by FEMA, and we got it from FEMA. So we received it, and the day before yesterday, we gave one to GMH, and we kept the other one in our laboratory. Now, this is a rapid test kit, and this testing can be done where a positive result can be read within 5 minutes, and if you are testing negative, it'll take about 13 to 15 minutes. And so yesterday, we actually trained also the hospital staff, their laboratory staff, and we got them to calibrate and validate the machine and also utilizing the test kit that we have. And so I'm happy to report that everyone has been trained, and they used it for the second batch yesterday in yesterday's test. So we're running 2 tests. Yesterday we ran 2 machines, the AVI 7500 and the Abbott ID Now, and we're assured by the federal government through CDC that we're going to continue to get more and more tests for the Abbott ID New Now. And not only Guam, but the U.S. API should be receiving it as well. After speaking with Ms. Muña, she indicated that she hasn't received her Abbott ID Now. So the thing about it is I want to ensure the safety, as I mentioned earlier, and even if Saipan were to use this kit, it's not yet approved. They're still applying, as I mentioned, for the emergency utilization authorization. And my concern is that if we were to use it in Guam, it may test negative, and a false negative is not going to be very good because that person could be truly, false negative means they may be positive. And so I'm very reluctant at this point until I know it's either approved by FDA or there's an emergency utilization authorization that has been granted. Then, of course, we will look into that as well. So I hope that answers your question. In addition to that, the Gene Expert machine is also being purchased by Guam Regional Medical City, and we also have a Gene Expert machine in our laboratory. And we're just waiting right now, as I mentioned earlier, for the arrival of 4,600 test kits. That's through a grant that was funded through the Pacific Island Health Officers Association. And on top of that, we are also looking into getting that machine up and running along with GRMC. And we have been sending actually a lot of the low priority, as I've spoken to you and Sabrina earlier when I'm being interviewed. We started that with the diagnostic laboratory, and as I mentioned, it goes to Hawaii and also to Quest, California. So even those with asymptomatic swabs, those patients that have swabs, nasopharyngeal swabs that are asymptomatic, we're still testing them, but we're testing those off island, and that's again through DLS, through Hawaii, or through Quest, which is a commercial lab. We started that on April 3rd. Through the 13th, we have already sent out 101 specimen samples And of that, 5 has tested to be positive and 96 are negative. So I just wanted to throw that in. And, we've been also assisting the other USAPI in their testing. So, they're getting that support from us, and that's the reason why we've been granted one of the first in the Pacific to actually have the testing capacity through our ABI 7500 machine. And so with the USAPI altogether, we've done 58 tests for them. So we're moving forward, and of course with the support, we've been getting lots of support from CDC, and we follow their guidelines. And so I just wanted to assure you that we're going to continue to get the support from them and also through FEMA.
Well, Linda, thank you for bringing that up, because that was a lot of the messaging I was getting last night, that these tests aren't FDA approved. But then also, concurrently, people were saying that, yeah, they're not FDA approved, but that there are big deliveries of these tests going to the federal government. Is that accurate? What can you say about that?
Yeah, you know what? It's not yet approved for emergency utilization authorization. Okay. So if that's not approved, nothing is going to go through if you don't have the FDA or the emergency utilization authorization, or what we call EUA.
Right.
So, until that happens, nothing's going to happen until we get that approval. Okay. And safety is our key here. And you know that. And after speaking to Esther, she indicated to me that they're not even using those 20,000 for diagnostic purposes. So what does that tell you? That tells you that diagnosis is not going to be considered with those test kits.
What does that mean in English, Linda, for our lay people?
Is that if a person were to be clinically diagnosed or in the hospital and they're taking a test, the test is the only way to identify if they're truly positive or negative, is one way through this, having a very valid test, which is through, in our case, the ABI 7500, and now with the Abbott ID. That's the only way we can determine if they're indeed positive or negative. Or a clinical diagnosis. What that means is if the test does come out to be negative, but there are signs in the x-ray that they have a glassy look that is COVID positive, the physician can diagnose the patient as having COVID positive due to the clinical diagnosis and the assessment through radiology. Yeah.
The 2 new machines you were talking about during the press conference yesterday, you made these are more of like a rapid type testing, right? So are these through a swab, or are they a serological?
No, it's not serological. It's a nasopharyngeal swab.
Okay.
It's the same way you do the ABI 7500. Okay. It's a test that you just take a swab through the pharynx real deep, and then you take the sample in there, and then we run the sample through the machine. And so that's how it's done. So it's done pretty much the same way. It's not a serology. It's not a serum where you prick your finger and you run the test. Yeah.
But they can be run within 13 to 15 minutes, right?
If you test this, it's 13 to 15 minutes. If you test positive, it can give you a result within 5 minutes. So imagine the speed of that, right? Compared to the ABI 7500. Our ABI 7500 runs for 6 hours for 20 tests. And that's why you see a first batch coming in the towards the late afternoon, and the last batch coming out by, let's say, 9 o'clock, 9:30. Yeah, and so this is a PCR, which is a polymerase chain reaction type of testing. It's similar to the Gene Expert. It's also a PCR machine, and that's another machine we're waiting for more tests to come in. But I'm assured by FEMA and also my lab, and they have close contacts with CDC and the IRA, and they are getting a lot of their test kits coming in through the Abbott ID now, the rapid testing. So we're going to increase our speed in that very shortly.
For the 4,000 test kits that we're still waiting to arrive for the Gene Expert, you also mentioned that GRMC was getting a Gene Expert machine. We already have our own. So for those 4,000 test kits, are we going to split them in half, 2,000 going to GRMC, or that whole entire 4,000 is going to public health?
That whole 4,600 will be for public health. I believe the hospital has ordered their own supplies and their own machine.
Okay.
Linda, so I just want to ask about the tests that we're doing, because hasn't there been instances where people have tested negative and then later tested positive? Is that because of the test kits, or is it more to do with the way the virus is?
No, it has also a lot to do with the way the sample is being taken. Sometimes the nasopharyngeal swab is not done right or well. And so sometimes we have to do what is called, it's inconclusive. The result may not show whether it's positive or negative. That's one incident. The other incident, if it's negative and it reverts to positive, the person could be asymptomatic. Maybe there are not enough viral loads yet. There's not enough viral samples in the individual or the sample that was taken, and then maybe when they redid it, they deeper into the pharynx and they can get more of a viral load and a better type of test sample.
Right.
So that could happen, or they revert. Sometimes they are in community contact or a household contact that they may have been exposed to somebody that could be asymptomatic and have gotten the infection. So then they obviously later on during the incubation period, which is 2 to 14 days, they can acquire the infection.
Linda, I wanted to ask you said something during the press conference yesterday. One of the media had asked about why there's this unwillingness to identify the two, one public health clinic and the private health clinic where I guess people caught COVID. And maybe you can respond to that after you answer, but my question was, you had said something, I believe, about you were testing all the healthcare workers at these two clinics. Is that correct?
Yes. Everybody has been all tested.
Okay,
yes.
So does that have anything to do with the last few days of the zero positives? Because I'm just trying to work it all out in my head here.
In regards to all of them, they've been tested actually since that time that we released the information. They've been undergoing lots of testing. In fact, this has been after the March 25th. This was the second batch that we indicated. So we did a lot of the surveillance and contract tracing to identify who these workers were exposed to and what household contacts or community contacts. So everybody has been examined already, and so we pretty much have it under control as far as all the contacts that have been made. And again, you never know. I always emphasize that we can do all the tracing that we want, but sometimes when we ask people questions and they don't answer it correctly or they're not truthful, then we just have to get their responses in good faith. And so when we do the investigation, that's part of what we are asking them. Have you traveled? Who are you in close contact with? Have you been in any settings with other people, clusters and so forth, and group settings and group functions? And that's how, we're trying to identify them. And we've gotten a lot of responses from individuals also that have been positive, and there's still a stigmatism attached to those that feel that they are positive. And we just want to, I'm bounded also by HIPAA, and I can't release any names. And I just want to protect the integrity of the business as well. And also knowing that everybody knows who they are and that they've been identified. I'm
Linda, but just to play devil's advocate here, or just advocate, you guys named Hofade Bingo, which is a private entity. You named the Iglesia de Cristo, which again is a community civic organization. So for a lot of people, it just doesn't fly that we can tell people and talk about where other clusters have come from, but not
United Airlines.
Right. Yeah. So can you kind of just, because the logic doesn't match up in a lot of people's minds.
Yeah, I know. It doesn't match up, but again, I just wanted to emphasize the stigmatism attached, and so we just want to, just keep it at that at this point in time.
You also said, though, that one was public and one was private. So what public clinic are we talking about?
Well, there would be the public health clinics and then GMH, right? Are those the only public clinics?
Those are the only public clinics we have.
Right. So it's got to be one of those.
So can you say if it's north, central, south?
I would, Sabrina, I just want to just move on and keep that as the way we are reporting.
Okay, let's just move on. What about, I wanted to talk a little bit about public assistance, because we did talk with Tess Archangel, and she really gave a wealth of information. And, with the 400, especially within the past 2 weeks that have rushed to apply, but they're having an issue with providing the necessary and required documents. And I know that during one of the press conferences, you were mentioning how, you're trying to reach out to the mayors and work with them. Where are we?
I spoke to the president, Mayor Savaras, already, and she already assured me that all the mayors are informed and they're notified that when we have names of people that need to be verified, that we just send them the email of the listing, and then they will respond to give us the verification. So she has assured me that that has been in place. And so right now, we're also waiting for more information to be gathered in regards to the application process of those that have been furloughed and those that have had reduced hours, or those that have been laid off. So we're just getting that information, and we're just waiting for that information to come in through the Department of Labor. For the names of employees, we're just pending the names of employees, which is required for our BES, the SNAP, to process their applications.
Okay. Is the funding for this program, is it local money or is it federal money? Is it a reimbursement?
For the SNAP right now, the SNAP, which program are you talking about, the Medicaid or the SNAP?
SNAP.
Okay, for the SNAP, it is federal, absolutely federal. This is what we call the emergency allotment funds, so that anyone that is already a SNAP recipient, they're going to get the maximum amount. And that's what they're working with DMR to get also the listing of all those individuals, because DMR is our vendor with our PH Pro. And so they're having to calculate what would be the maximum benefit, and so that's also what we're waiting for. So we should get that done hopefully by at the latest next week. I'm assuming it would take only 1 week. That's what I was told by Tess.
Linda, I got to ask you about this. There's something going around with the GITA director, and I don't want to get into the specifics of it because I'm pretty sure there's some type of HIPAA thing. But are we still allowing people with significant ties to the community to skip out on the mandatory quarantine?
I think the quarantine is different from. I have to explain what quarantine versus isolation. The quarantine.
So Linda, I'm sorry to.
We know the difference.
Yeah, I'm sorry to interrupt,
okay.
but can you just speak specifically to that instance where people are saying that the director of GITA was allowed to, skip out on the mandatory? Because I was under the impression that all flights coming into Guam were subject to quarantine in the hotels.
Yeah. I cannot say about the HIPAA requirements, but in this case, when we identify anyone who is in quarantine, this particular situation, we have. I would just say that when we isolate individuals, there are different ways of isolating people that have become. Either negative, reverting to another test being positive, and the isolation could be either in the home. That's if they exhibit mild symptoms, or they exhibit symptoms that are asymptomatic, which means they have no symptoms at all. And then there's another way that we also do it is through the actual government of Guam facility, where they can stay, or they're either hospitalized or they are at the SNF. And so because of HIPAA compliancy, I just want to share that information.
Right.
And, I don't want to release any information about any individual because, I'm bounded by HIPAA.
Yeah.
But just to notify you, I have been at court, and, that I did explain to the judge that when there are times when people are also in quarantine, when they have other issues, for example, they have comorbid issues, chronic diseases, or they have lung COPD, anything of that nature, or they have behavioral health issues, that we've moved them out of quarantine in our government of Guam facility, and we've moved them into home quarantine. So I hope that explains enough for you to put it together.
Yeah.
Okay?
Okay.
Yeah.
Okay.
Yeah, and so we've done that. I was very honest at the court, as I have to be.
I'm good at putting stuff together, Linda, and I could see what you're saying without you saying what you're saying.
Yes, thank you very much. I appreciate that, and in all integrity, for the purpose of not releasing any health information. Thank you. I
guess last question that just came in on the Facebook comments. The decision to not disclose which two clinics gave patients COVID, was that public health's call, or was that something that the governor decided?
I'm sorry, can you repeat that question again?
The decision to not disclose which 2 clinics gave the patients COVID, was that public health's decision or the governor's decision?
It was my decision, and I take that because of the fact, my decision along with my team, we discussed that very thoroughly. And, you know, the clinics are the forefront. They're the ones that are helping the patients. And we wanted to maintain, there have been, as you already know, and I've been mentioning, there are healthcare workers that have been positive. And that's also in line with what has been happening through household transmission, community transmission, and close contacts. And so we want to maintain the integrity of our whole system, especially the healthcare system, which is very, very critical to the operations of this COVID response.
And just real quickly, where are we with the other cluster investigations then? We have the Iglesia Ni Cristo.
Yeah, I'm glad you mentioned about the Iglesia Ni Cristo Church. Yes, when I reported we had 11, remember when that press came out through JIC, now we're at 17 positive from that cluster. All the other clusters remain okay. We found out also that the Manila was cleared in terms of there was no exposure on that side of the Manila after we have done our investigation. But the other 3 churches, the 3 sites of the Iglesia Ni Cristo, we've examined 320 individuals. I just wanted to share that.
Have any of this been linked to what happened in Saipan?
Yes, actually, there were 2 cases that came from the Iglesia Church, the Iglesia Ni Cristo, that were positive for Saipan. Yes.
Okay, but you guys aren't communicating where they are with their trace investigation. I'm just wondering, did it come from Guam and they went over there?
Yeah, they flew to Saipan, but we give them the results because, as you know, we do test for Saipan and the US API. And yes, we've given them the results, so they're very much aware. And I communicate a lot with Esther Muña. We're very good friends, and we're very much involved with the Pacific Island Health Officers Association. And so we provide a lot of information with each other, and we help each other, if we have any needs. And she has also shared that any supplies or equipment she needs, we can share it together, as we have been doing.
All right. Well, thank you so much, Linda, for your time.
I know you. That was a long 10 minutes. I really appreciate it.
You always do that to me, Chris.
I'm sorry, but I mean well. I'm just trying to get the info out.
I know, and I mean well too.
I know you do.
The factual information.
Yeah, amen, Linda. Amen. Thank you. That's what I love about you. You're like one of those boxers. You're going to stand in the pocket and you're going to take the shots and you're going to...
No, you know what? I've been boxed so much that they always hit me. I always fall to the ground, but I always come back up with all my staff. Everybody always critical, but our mission is to move forward. And even though we're criticized heavily, we do the best we can, and we are doing God's work. That's what's most important.
All right, Linda. Thank you so much. God bless you, okay?
You and your staff.
Yeah, wash your hands.
Thank you. Bye-bye.
Okay, bye. There you go. Linda and Pinko Denorcey. Yeah, she's always willing to answer the questions, but, the thing is you got to get her.
Yeah, when she's right at that time.
Outside of the press conference.
Yeah.
Okay.
Thanks again.
7:44. We got to take a break. Coming up, hey, we got a commitment from the chief of the Guam Police Department to call in 8:30 this morning. That's, of course, Chief Stephen Ignacio. Also, we're going to hear from former Senator Dennis Rodriguez.
Yeah, he's on this, the speaker, she has this, her medical advice, COVID-19 advisory group. And so we got that letter last night, and his name